the Charlton Senior Center. Today we have an informative and educational presentation for you. I would like to introduce to you Commissioner Kimberly Roy. By the way, I am Michelle. I am the Senior Center Director here. If I haven't met you, to the folks at home, come on down to the Senior Center and get to know us if you haven't. Commissioner Kimberly Roy was appointed to the Massachusetts Cannabis Control Commission in July of 2021 by former Governor Charlie Baker. Since then, Commissioner Roy has led several notable public health and public safety initiatives, including a partnership with the Massachusetts Registry of Motor Vehicles, AAA Northeast, and additional stakeholders to create and implement Shifting Gears, a commission-approved curriculum to educate teens on the risk of cannabis-impaired driving. The first of its kind in the nation. Very impressive. Serving in the Commission's public health seat, Commissioner Roy has also focused on educating the public about safe and responsible consumption and youth prevention, and has penned several op-eds to this end. Commissioner Kimberly Roy is an advocate for cannabis research funding, as well as removing barriers to veterans' access to medical marijuana. Commissioner Roy has an extensive background in public safety and substance use disorder prevention, having served over a decade, how could that be when she's only 29, as a member of the leadership team at the Worcester County Sheriff's Office. It recognizes the impact of addiction crisis on the criminal justice system and focuses on youth. Commissioner Roy holds a Bachelor of Arts degree from Western New England University and a master's degree in professional communication from Clark University. This lady is educated and well-versed in the subject. Please make a warm welcome to Commissioner Kimberly Roy.
Thank you. Thank you all. I want to thank the Senior Center, Charlton Senior Center, for inviting me today, and Director Michelle Drum for inviting me, and our team here from the Cannabis Control Commission to be with you this afternoon. I also want to take this time to thank Charlton TV, their cable access, where you'll see this presentation in your home. So today we're going to take about the next 45 minutes, and we're going to go through what's fairly still a new industry in Massachusetts, the cannabis industry, and what the Cannabis Control Commission does, the purpose it serves, as well as the adult use program and the medical use program. And I have a team here with me today, and I will introduce them a few slides in. So having said that, let's go advance the slides. So the mission of the Cannabis Control Commission is to honor the will of you, the Massachusetts voters, by safely, equitably, and effectively implementing and administering the laws enabling access to medical and adult use for marijuana in the Commonwealth. Mouthful, right? What does that mean? So let's keep going. So presently, by statute, there's 5 commissioners. We have 1 vacancy right now. So we have 4 commissioners. We have an acting chair. That's Commissioner Stebbins. He's in what's called the regulated seat. And he served in the Gaming Commission that oversees the casinos. He served there before he came over to cannabis. Commissioner Camargo's in the social justice seat. Commissioner Concepcion's in the public safety, and I serve in the public health seat. And we all have appointing authorities, whether it's the governor, the attorney general, or the treasurer, and some of the commissioners are appointed by all 3. So my priorities, and Michelle was really kind to do that introduction. Thank you so much. And I will just reiterate a little bit of the priorities. I sit in the public health seat, but that doesn't mean I'm exclusively focused on public health. We all are, right? So we want to make sure this industry is safe, that it's effective, and it's equitable. So some of the things I focused on when I became a commissioner in my previous experience at the Worcester County Sheriff's Office, and I'm here with Stephen from our team, and he served in the Sheriff's Office with me, and Stephen and I saw firsthand the ravages of the opioid epidemic, and you've all read about fentanyl and the lives that it's taken, and we worked with the inmates, and we saw almost 90% of the inmates incarcerated today have substance use disorder issues, and it really affects not only those individuals, but their families, their children. So we worked really hard on how do we help those folks? How do we help them turn their lives around? And we really focused on reentry, rehabilitation, and we focused on prevention as well. So I took those skills at the Sheriff's Office and I brought them to the Commission. So I really focused on education and prevention, especially with our young people. Research, right? The cannabis plant is thousands of years old. And we have very limited research, medical research, on how it can help you, especially older Americans. I know are very canna-curious. I've done these talks all over the Commonwealth, and we get great questions, and I'll just ask you if we can save the questions to the end. We save plenty of time for questions, but the medical research has not kept up with the how old the plant is, right? And as of today, 2/3 of the United States has access in some way, shape, or form to legal cannabis. Some states have both adult use and medical use legal, like Massachusetts. Other states, like Florida, just have medical use, although I think it was on their ballot recently. But the research, because it's still federally illegal, it's a Schedule 1, which means the federal government, in the eyes of the federal government, cannabis has no medicinal value, no value, and a high possibility for abuse. And they put it on par with heroin. But right now, as we speak, the federal government is re-examining that, and they're considering rescheduling it from a 1 to maybe a 3, which would acknowledge by the federal government that there is medical value to cannabis. So there's a lot of possibilities there. I think that'll open a lot of doors for research. Imagine if we had clinical studies that we knew how it worked on different comorbidities, whether it was anxiety, sleep, depression, chronic pain, autoimmune diseases. It would be amazing, great information to know. So I advocate for research. I think Massachusetts, although we really have not invested anything in public research right now, based on our universities, our hospitals, our life sciences, I really firmly believe that Massachusetts can be a global leader in research, and I'm going to keep advocating for that. Veterans access. Our veterans, right? We owe any veterans here. Thank you so much for your service. Thank you. My dad was a veteran. He served in the United States Air Force. I thank all our veterans. We are eternally grateful to you. You defend our freedoms here in America and abroad, and thank you for that. And so many veterans that I've spoken with have unfortunately come back with whether it's PTSD or some life-debilitating injuries. And most veterans get their health care at the VA, which is a federal health care system. And that's wonderful, and we're grateful to that. But because it's a federal health care system, and cannabis is federally illegal, the conversations really aren't being had or cannabis therapy really isn't being talked about because of that barrier. So our veterans have to not get their health care, most of them at the VA, but then they have to pay additional to get certified as a medical patient, and that's a financial barrier to our veterans. So I worked really hard with my fellow commissioners, and we voted unanimously, and we brought it to the Massachusetts legislature to reduce barriers for our veterans, so they don't have to get that second provider, and they can take whether it's their blue button report, and those who are veterans know what a blue button report is, right? And if you have a qualifying condition, then the commission would automatically certify you. So we're working towards that as well, and we hope we will get there. Testing, and I'll talk about that more. What sets us apart from the legacy market is testing. You need to know that the products that you buy have been they're safely regulated and tested. And we test for heavy metals and pesticides and pathogens because we want you to know that the products that you're ingesting and taking are safe and they have been tested. And then outreach to older Americans, and this is one of my favorite parts of the job, getting away from the computer and meetings and getting out into the community and speaking with all of you and speaking with folks at home who have many questions about cannabis. So today is about education. So Michelle was kind enough to talk about the driver's ed. I'm really proud of this. When I became a commissioner, Governor Baker had called me and he said, would you be interested? Former State Senator Jen Flanagan was the commissioner prior to me in this seat, and when she moved on to a different opportunity, Governor Baker called me up and said, would you be interested in filling this role? Based on your background, I think it would be a good fit. So as I was getting sworn in, literally at the State House, prior to that, someone pulled me aside and said, do you realize in the driving schools in Massachusetts, and across the country that there is no education around cannabis impairment behind the wheel when you drive. And there's plenty about alcohol, as there should be, right? Everybody knows about a breathalyzer, 0.08, but there's nothing about keeping our young people safe behind the wheel. And what they were getting is through social media platforms, which was a lot of misinformation and disinformation. So I said, I'm going to fix that. I'm determined. So I put together a working group with Commissioner Stebbins and myself in AAA Northeast, and the Lieutenant Governor was very helpful, and the Register of Motor Vehicles was very helpful. And we had a curriculum that was already built in Rhode Island for healthcare classes, and we modified it for Massachusetts. And a year ago, January, we announced we were the first state in the nation to mandate in every driving school class that they get this education behind the wheel. If you feel different, you'll drive different. We don't stigmatize. We provide evidence-based information for these young people. And last year, 50,000 young people saw this curriculum. And every year they will see it. And since then, other states have followed through. So thank you so much for that. I appreciate that. Okay, we talked about veterans, and so we can move on with that. Okay, and the commission was a startup 7 years ago. Handful of folks were in Boston, and less than 20 employees. And they had to think about it. Not only create an agency, but an entire industry. That's a lot of work. It's very complicated. Fast forward to where we are today in 2024, we have about almost 140 employees, and we are a $7 billion industry. $7 billion with a B if you combine adult use and medical use. So we have gone from a startup to more of a mature agency, and it's been a lot of hard work. Our team is very talented. They are very dedicated and very committed to this agency and to the industry and to make sure that folks have safe products. And I'll talk more and we'll get into more details, and we try to help certain communities more as well. Okay, so today I am blessed to have a great team with me. We have Kathy Oliver Jones. Kathy, if you could stand up. Kathy is the director of our constituent services. She does our medical program. She's going to speak to you on how to become a medical patient. I'm going to hand it off to her at one point. We also have Steve Caracello. He's the manager of equity program committee. Steve, if you can stand up. So at the end of the presentation, if you want to say hi to Steve, he has information, I believe, on how to read labels, right? And some other information on product types. So he has some valuable information for you at the end if you want to see Steve. And then we have Neil McNamara. And Neil, if you could stand up, he's our press secretary. And Neil just joined us recently, but we're very grateful to have him. And Fiona, if you could say Pierre, with the camera, Fiona always has the camera, and she is in charge of our media and digital content for the commission. She does a wonderful job. So thank you all. I appreciate you being here. So let's talk about how did we get here today, 2024, in a $7 billion industry, right? It didn't happen overnight. So when you guys remember, we're going to do a little visit in time backwards, if you will. In November of 2008, the voters of Massachusetts voted to decriminalize cannabis. And that got approved overwhelmingly, 63 to 34%. Fast forward 4 years later, and then the voter initiative legalizing marijuana for medical purposes got approved. That got approved overwhelmingly, 63 to 37%. And then in June of 2015, we had the first medical treatment center open in Massachusetts. November 8th, 2016, question 4, you may remember. This was to legalize adult use in Massachusetts, and that it got approved, but much more narrowly than the other ones, 53 to 47. And that made Massachusetts the first state east of the Mississippi to have legalized adult use cannabis in the United States. And the first state to have an equity mandate. And we'll talk about that more. And just at a high level, what that means is when cannabis was illegal, there were certain communities that were disproportionately incarcerated, arrested, because it was illegal. And so how do we go back and help those communities now that people are making money off of this industry, right? This is the #1 crop in Massachusetts that outpaces cranberries. And how do we help those certain communities, like Worcester being one of them, Springfield, Holyoke, New Bedford, Boston, and there's a number of communities that we really make sure that we invest in those communities, that we have positive impact plans that give back to help people who want to get in the industry, maybe formerly incarcerated. Imagine being formerly incarcerated due to marijuana prohibition And how do we help those folks get into this legal market now? So the commission works really hard on that. So in July of 2017, Governor Baker signs what's called Chapter 55, the Acts of 2017. So now the voters passed it, the legislature tweaked it, and the governor signed it into law. And then in September of 2017, the first 5 commissioners, the inaugural commissioners, were appointed. In 2018, the initial regulations were, and that was a lot of work, approved by the commission. And in 2018, the first license applications were accepted. So here we have a picture from November of 2018. Now you guys, you're not far from Leicester, a few towns away. And I don't know if you remember reading in the paper when the first 2 opened. The first 2 opened, one was in Northampton, and the other one was in Leicester. And it was around Black Friday, so maybe we can blame Black Friday, but the lines went for miles, the cars went for miles, people were there early. This is a picture in Northampton. That's the mayor of Northampton. He's making the first purchase, the first adult use purchase in Massachusetts, and I'm told that purchase is now in a museum. Who knew there was a cannabis museum? I didn't know that, but apparently it's in a museum out in Northampton. Okay, the local view. So what's going on right in your backyard in Charlton, right? And you might know this already. Charlton has 2 adult use marijuana establishments and 1 marijuana medical treatment center. And if you say, well, I don't know where it is, if you have access to a computer and you go on the Cannabis Control Commission, you can find a retailer or medical treatment center near you. It's very easy, user-friendly. You put in your zip code, you put in a mile radius of how far you're willing to travel, and all of them will pop up for you. Okay, so the medical use of marijuana program, Kathy's going to explain to you how to become a patient. I'm going to go through the first few slides just to give you a little background on it. So, by the numbers, there are 107 medical treatment centers in Massachusetts that are open for business. We have almost 100,000 patients, medical patients, cannabis medical patients. We have 6,500 caregivers, and Kathy's going to go over that, but in a nutshell, what does that mean? So my mom has an autoimmune disease, right? So my mom became a certified patient, and she doesn't want to go in a dispensary, doesn't want to. Okay, Mom. So I became her caregiver, and I'm able to go in with a commission-issued ID and purchase her medicine on her behalf. And why would anybody become a medical patient? Well, you obviously would need to talk to your healthcare provider and see if they feel cannabis is the right fit for you. But there's no tax. If you're a medical patient, there's no tax on the products, where if you're going to an adult use dispensary, it's 20% tax. And there's no, the caps on potency aren't there because we have cancer patients, right? People in hospice, folks terminally ill, people in chronic pain who need those higher doses of cannabis to be efficacious to help them with their pain. So we have over 300 registered physicians. I'm hoping that number will grow. I don't think it's enough right now. We're hoping to get more. We have 118 nurse practitioners and 1 PA. And then we've done almost $100 million in MTC sales through January to June 2024, and $1.3 billion since 2018. So that's pretty impressive. Now, we don't put the providers on our website. You'd have to kind of Google that. Unfortunately, we're prohibited from doing so, but they're out there. And chances are your primary care is not, but it's worth asking, and they might know. Because my mother's, ironically, her primary care happened to be certified, so that was really convenient for us. Okay, let's just look at the map. So every county has them, and Worcester County has 19 medical treatment centers. So they are accessible to you folks here. Okay, and then I'm going to go hand it over to Kathy now. She's going to talk about what it is to be a provider, what it is to be a healthcare, a caretaker, and how to become a patient. Because some of you may have questions. How do I even become a certified patient? So Kathy, why don't you come up and you can do the medical portion, and then I'll pick back up.
Thank you very much. Thank you. Actually, I feel I'm among friends. I've been here for a while, and you've been so gracious in hosting me, if you will. So let me continue with the presentation where we're talking about certified healthcare providers. As Commissioner Roy said, that you must have a Massachusetts licensed physician. They must be, or a certified nurse practitioner or physician assistant. They do have to register with the program. So if the doctor is not registered, we can help them with that information, and my team can reach out to them, provide them the information, and then go through that process. They cannot serve as a personal caregiver because that would be double dipping. Think about that. You don't want a patient and a doctor connected as a caregiver, because then that would make them seem like that they're really overstepping their role. There is no fee to provide and receive your card from the program. We eliminated the $50 fee quite a few years ago, so that is great for the patient because we want to support them, so there is no fee any longer. So, but however, the certified health, that's fine, go ahead.
That's my fault.
We'll keep moving. That's okay, we'll keep moving. Let's look at the diagnosis and the certification. So, first of all, you must be 18 years of age or older and diagnosed by a certified healthcare provider having a condition, and we do have a list of those. So, once again, but we are not clinicians. When patients call our line, we're not clinicians, so we cannot give medical advice. So we always make sure they connect back with their healthcare provider and also their medical marijuana healthcare provider if he's not or she is not registered with the program. So we do have a list of the conditions that our program does support: the weaknesses, the weight syndrome, intractable pain, and the nausea. So there's a lot of things that patients go through that is more than just this. So that's why it's important that we are connected with your doctor and your medical marijuana healthcare doctor. There are also other qualifying medical conditions like cancer, glaucoma, HIV/AIDS, and Crohn's disease. So once again, we are not clinicians, we're not doctors, but if you feel like there's something that you want to support yourself in your medical journey, talk with your primary healthcare doctor, and they can connect you and make sure that if you're going to use medical marijuana, it is part of your healthcare plan. All right, so we're still talking about the qualifying patient. So the doctor, qualifying certification, I'm sorry, I've been here a bit, so I'm a little nervous before my friends. So the doctor is not going to give you a paper prescription. We do have a system where they put your prescription basically in our system. That's why the doctor must be registered with the program. They put your information in our system, and then there is the second step. And this is the one thing that I am really wanting to really drive home is that when the doctors, for some reason, after you get your certification, they say you're all set. So patients go home and they wait for their medical marijuana card. And then they finally call my team and say, I didn't get my card. There is a second step. You must register with the program, provide us with your information, or we can provide your card. So that's one of the things that I want to continue to work with the doctors on. Don't say that all set. Say next step is. So once again, they can certify you for 15 days and also not longer than 1 year. There are some exceptions with the 1 year. Based upon your condition, some doctors can go more than 1 year and go to 2 years. The medical products are not restricted by potency limits and are not taxed. That is part of the medical program, and that's different than the recreational. So there is no tax on the medical products. So once again, talking about the qualifying patients over the age of 18, and they are approved by a certified healthcare. If they are under the age of 18, they do need more than one healthcare provider to certify them. My pediatric patients, and those are my heart, the pediatric patients, to make sure that they have what they need, they have to have their pediatrician and a healthcare provider that's registered with the medical marijuana program. Hardship cultivation also allows patients to grow, and this is one area that is still kind of like growing, if you will. There are persons that do grow, but they do have to make sure that they are not growing more than that it yields a 60-day supply of their personal medical use. And also, they can't have up to 5 caregivers. So I use the same example that you do, Sister Commissioner Roy. I use the same example. My daughters live in Kentucky. If I had a medical condition that they need to come and stay and help me, they could get a caregiver card even though they are not a resident of the state in order to go to the medical treatment center and obtain my medicine for me. So let's pray I don't get to that point, but that is possible. Also, we do have to renew every year. That's another thing that patients sometimes get. Okay, my card says this, my certification says something else, so we kind of make sure that we marry those two dates together for them, where they realize that their card is always 1 year. But the certification, once again, as a doctor, can certify them for less than 1 year, which means that they're getting good medical care because they're going back and talking to their doctor to see how's the product and the medicine that I'm taking, how's it working with my condition? Is it helping, or do they need to change the dosage, or get guidance on what type of medical product to purchase? And now you've already talked about this a little bit, but how to become a qualifying patient. You must be 18 years or older and a resident of the state, unless, once again, you have a condition that you come in-state. We do have some patients that come in-state. They are also being able to register because we support them with that. You also have a written recommendation from the certified healthcare provider to be part of the patient. You just can't walk in and say, I want a card. That's not part of the medical program. But you can, once again, go to the recreation side, but we want you to get your medicine, and also remember that, or let me note that some of the medicine at the medical treatment center is not available on the recreation side. All right, so here's the thing. Patients go to the doctor, and then they go home and wait for their card. But there is a process to get your card. There's an application process, and it starts with that PIN number that the doctor provides you with. Or call my team, and we'll help you make sure that you get all the information you need to get your card. So kind of like I've talked about this a little bit, but once again, to become a qualifying patient, you have to apply to the program. I just mentioned that a lot of patients go home and just wait for the card to show up, and they're like, oh, I didn't hear that step, and no one told me about it. But my team is there ready to help them to make sure that they get their card and register all their information with the program. There is no fee. We used to have a $50 fee, but we eliminated that because we want to support patients. That $50 fee can go to their purchasing their product and their medicine. I should stop saying product or medicine. You must always carry your program card with you. Whenever, just put it in your wallet along with your license, because that way you always have it with you. Especially if, let's say, for instance, you just left the medical treatment center, and heaven forbid you get stopped by the police, and they see a package on your seat. Well, as a medical patient, then you can verify that, I just was getting my medicine and I'm on my way home. All right, and then I think I'm at my last slide. The qualifying patient certification, once again, they are required to go to a provider that is registered with the program. You also must have your valid driver's license, or in order to register, a valid driver's license, or a passport picture. We can pull your picture from your license if you use that, but if you only use a passport or do not have a driver's license, we will need a passport type picture, because that's going to be on your card. And if you need any assistance, call me. I'm available. My team's available. We're at the number at 833-869-6820. Our phones are open to 3 o'clock, but we also make calls outside of 3 o'clock. We call back if you need a call back. We will email you. We will make appointments. We are there to support you at any time for your medical marijuana program. That's a patient.
So let me just stop right here and thank you, Kathy, for that. It's very important. Stay here with me, Kathy. Perfect. So the important takeaways from that, right? So you see a certifying provider, and they say you have a condition, and they feel cannabis is appropriate therapy for you. So your healthcare provider, your certifying provider, is going to generate a PIN, which will go to the commission. But that's step one. So you saw the provider, you got the PIN. Step two is you'll be in touch with the commission, and you'll have to provide the documents Kathy said. So the passport type photo, you have to prove residency, so maybe utility bill. And then Kathy also, so we want folks to have access to your medicine right away. So Kathy, talk about that temporary card. There's a temporary card that you would get as a patient. You want to just share that?
Absolutely. So because it takes a few weeks to process your plastic card, we do provide a temporary card that is available to you from your account, or we can print one out and mail it to you. It's a 14-day card, and that way you're not having that big gap of not having your medicine before you receive your plastic card.
Mm-hmm. And then the final piece is, Kathy said most of the certifications are good for 1 calendar year.
Yeah.
So there's 2 dates that you need to remember. So the first date is I need to get recertified. So I have to go see that provider again, and we're going to talk about this more. You don't have to physically go in. You can do it all on telehealth now. The commission approved that unanimously to make it really easy for you to have access. So that's super important. And then the second one is the date that you got your card. So you have to keep those 2 dates in mind. So when a year I've been on cannabis therapy, it's helping me. I want to continue. I need to call back my provider and get recertified, and then I have to get a new card because, you know, like your driver's license expires every 4 years. Well, this one expires every year, and you need to have a new card or you won't be able to use it to purchase. So those are 2 things that kind of get a little confusing, so I just want to pause here and stress that a little bit. So, Stephen?
I was just going to say one more thing about the dates. One of the things that we make sure that the patients understand, because it does get confusing. Again, the doctor can certify you less than 1 year, so they're always thinking, oh, I don't know which date I'm supposed to recertify or apply for my card. So we're constantly always sending out information, supporting patients, letting them know, and explaining that over and over as many times as necessary.
And Kathy, did you bring paperwork today?
I did.
All right, at the end of this, right, if you want to see Kathy, if you say, well, this is something I want to pursue and I want to talk to a certifying provider about, Kathy has the paperwork to help get the ball rolling for you. So thank you, Kathy, and I'll take it from here. Thank you so much, Kathy. So you mentioned a personal caregiver. You got to be 21 years old. A personal caregiver can possess no more than a 60-day supply, may not receive payments for being a caregiver, and may not sell, divert, use, or consume the patient's cannabis. Now, don't ask me how we got Tom Brady. Nobody can answer how we got Tom Brady to pose for this picture, but somehow we did, but just kidding. But so anyway, so I am a caregiver for my mom. I go in, I present that ID. I'm able to purchase what she needs and bring it to her. Okay, telehealth. And I'll just touch on this really quick. Before, it used to be the first visit had to be in person, but COVID happened. And guess what? No one was doing anything in person. So the commission did emergency where an emergency order where folks could have that first visit via telehealth. But COVID has since passed. There's still COVID out there, but the emergency order has passed. And folks reached out to us and they said, I don't have access to transportation to go to a provider. There's only 300 certified physicians in the state. I might have to travel very far. So we want folks to have access. So we remove that barrier where you have to be in person. So the first visit and every subsequent visit can be via telehealth. Okay, that's the medical program. And if we have questions at the end, you can feel free to ask. And Kathy is a wealth of knowledge and she does have the paperwork. So we're going to move on to the adult use. So let's talk about the laws. What happens in Massachusetts? How are you able to consume adult use cannabis? Well, you must be 21 years of age. You cannot consume in any form, including smoking, vaping, or eating in public places or in federal lands. Just like alcohol, it's illegal to drive while under the influence of cannabis, and it's illegal to cross state lines with cannabis, and it's also against the law to transport it through federal airways or waterways and other modes of transportation outside of Massachusetts. Now, I've talked to many different audiences, and one of them was the Chamber of Commerce, and you've all heard of the Chamber of Commerce, and I did it out closer to Boston, and it was a room full of business people, and I asked them, how many of you sell a product? And half the room. So I said, imagine the product that you sell. You can't cross state lines with it. You can't go through federal airspace, federal waters. You have no bankruptcy protections. You have no access to banking, and it's federally illegal. And despite all of that, this industry is the top crop in Massachusetts, outpaces cranberries, and has done $7 billion in sales, despite all of those headwinds. So that's pretty remarkable when you think of all of these things that make it really tricky, and it's a highly regulated, highly taxed industry. And despite it all, it's been an enormous economic driver for Massachusetts, and I will get into that as well as we move on. So did anybody read about the story with Martha's Vineyard? They were going to run out of, did anybody see it in the paper, in the news? So over the summer, Martha's Vineyard, there was there was one cultivation growing. So remember, you can't transport it over federal waters. So it has to be grown on the island. And the one cultivator was winding down operations. So what did that mean? There would be no access to cannabis on Martha's Vineyard, or you'd be breaking the law as it was, or the violations of the Cannabis Control Commission's regulations. So we had an emergency, we went public hearing out in Martha's Vineyard, all the commissioners, we went out and we listened to folks, and there were hundreds of medical patients that would no longer have access to cannabis. And many of them shared their concerns if they had to go back to the illicit market. You don't know what's in it. And some folks shared with us that they had some illicit products tested and it had fentanyl and some other unsavory ingredients in it. So it really, in my eyes, was a public health, public safety emergency. So the commission, we worked together and we came up in agreement with folks on the island that there is a channel, believe it or not, from Cape Cod to Martha's Vineyard that stays in state territorial waters. So this was a big deal for us. We had never really had anyone ship cannabis over by boat, but we did manage to come to an agreement that doesn't violate federal law and stays in Massachusetts water, and it keeps the people on the boat highly compliant, right? Body cameras, manifests. There's a lot that goes into transporting cannabis. So we were able to do that, and now folks on the island will continue to have access to safely regulated products. Okay, so you can't send marijuana by mail. And your employers, your landlords, cities and towns may have their own policies governing the use of marijuana. Under our regulations, adult use marijuana is limited to 5.5 milligrams of THC in a single serving, like a gummy, a single serving, with no more than 20 servings or 110 milligrams in a single package, like a candy bar. So it would be scored. If you got a chocolate bar, it would be scored by serving. And a gummy is no more than 5.5, and if it is, it's scored in the middle. And so that's 2 servings in 1 gummy. So folks, when I first started giving this talk, they said, well, what does an ounce look like? What does a gram look like? So I'm trying to describe it. I said, put it in the slide so we can see what it all looks like. So here's pictures of a gram, 1/8 of an ounce, 1/4 of an ounce, 1/2 an ounce, and 1 ounce. And so Massachusetts adult use, you can have up to 1 ounce on you, and you may possess 10 ounces in your home. And then retailers may not sell more than 1 ounce to you on the course of a day. Okay, types of products. And I want to thank Neil, our new press secretary, for this idea, because he says, well, why don't we put some of the products in there? And I said, you know, what a great idea, let's do it. So we added some products in there. So the different product types, if you were to go into an adult use retail store or a medical marijuana treatment, you would see flower, right? So flower refers to parts of the cannabis plant harvested for consumption, buds, stems, seeds, leaves, most often consumed by smoking. Concentrates. Concentrates are highly potent forms of cannabis that come in a variety of styles. Some of the tinctures that you see that you put under your tongue, and edibles, such as cookies, brownies, candies, beverages. So that is not, this says may take anywhere from 30 minutes to 4 hours. So I usually ask this, but now this is in the slide. So I've gone around to many senior centers, and I will ask, everybody knows about the cannabis gummies, right? And I ask, how long does it take to kick in? And no one knows. And the reason I ask that is because for some folks, it can take 1 to 2 hours to kick in. And you need to know that. So when you go to purchase, if you're new to cannabis, we always say, first of all, consume safely and responsibly. Start low and go slow, because you want to know how your body is going to react to it. And for a gummy, I don't want anyone to take a gummy and say, didn't work, and get in their car and drive to Target, and then in Target or Walmart, it kicks in, or what they call stacking. So you may take one and say, I'm not feeling anything, I'll take another one. So you don't want to do stacking either, and you need to know how your body will respond and how it will adjust to the cannabis that you take in. So 2 takeaways from that. If you're a medical treatment, if you're a medical patient, talk to your provider. It's super important. And if you go to an adult dispensary, they're called bud tenders, not bartenders, bud tenders. And they're really knowledgeable folks. They have to have training. They go through mandated responsible vendor training. Use them as a resource. Tell them, it's really desired effect, right? Some folks want it for sleep. There's different strains, sativa and indica. The joke with indica, they say in the couch, it's going to make you tired, going to make you chill, and then sativa. So depending on what the desired effect that you want, you talk to your provider, you talk to your bud tender, and you identify which products would be best for you. Topicals, I know many people buy some of the salves and the balms. and ingestible oils, and then the tinctures, as I mentioned earlier. Tinctures go under the tongue, and they all have what's called a different onset of action. The topicals, not so much, no psychoactive effects, but the flour, some of the oils and tinctures, you will feel it. So you really need to know how it is going to impact you. So I get this question a lot. What is hemp versus marijuana? And why can I buy hemp down the road at the local store and not have to go into a dispensary? So let me talk to you about hemp. This is really important. So it is from the cannabis plant. So marijuana and hemp both come from the same plant. And then in 2018, the United States Congress passed what's called the Farm Bill. And in the Farm Bill, they made hemp legal and recognized. And the difference is the amount of THC in hemp versus cannabis. 0.3 THC delta 9, it's going to be 0.3 or less to be classified as hemp, and if it's over 0.3, it's cannabis. So recently, you may have read in the news that you can buy intoxicating hemp. And so I spoke up on it because I really saw it as a public menace. It's a lot of cases, it's not tested. There's no age gate. Remember, you have to be 21. You can go. So I kind of used the phrase, and a guy got picked up. I called it gas station weed, and I said it was a public menace, and I believe that wholeheartedly. And so I'm really grateful to our partners in Department of Public Health. And some of them, you could get these beverages in the local package store, right? Infused seltzers, and restaurants were starting to sell them. So the ABCC, the Alcohol Beverage Commission, and the DPH and the governor, they all came out with a memo, and these intoxicating hemp products had to get pulled down. So I'm really grateful for that, because all of your products that you buy through a dispensary in a medical treatment center have a certificate of analysis, almost like their birth certificate, and it tells you all the ingredients, the cannabinoids, the terpenes. It tells you the potency, and it tells you that it's passed, and it has no pesticides or pathogens or heavy metals or anything. And these products didn't have that. And there was some unsavory ingredients, if you will. Everybody know what acetone is? Ever hear it? It's fingernail polish remover. So that was in some of these products, right? And you had some really unsavory ingredients, and they weren't tested. So I'm really grateful to our partners. Like I said, these products have since been pulled down. I know that I testified in front of the legislature about them, and I know that in the next session, in the new year, they're going to be looking at these products and where to put them. Maybe they fall under us to the commission. We don't know what the legislature is going to do, but I know that it does have their attention, and somebody gave me this term, that one of our independent testing lab tested over 1,000 of these hemp-like products and couldn't identify the chemicals in it, and we call them Frankenoids, Frankenstein-like compounds. And when I said that, and people in the legislature, they're like, what? What did you say? And then Frankenstein-like compounds. And you need to know what you're ingesting. You need to know these products are safe, that they're tested. They need to be age-gated so young people can't have access to them. So I'm really grateful to the legislature, and I know there's more to come on hemp. Okay, so for you, let's see. If you want to be a home cultivator, you got a green thumb, no pun intended, and you want to grow cannabis, you can grow up to 6 plants, and if there's 2 of you, you can grow up to 12 plants. Growing cannabis, any kind of farming, growing is a science. Every time I visit a cultivation site, I feel like it's like NASA. It's like the air temperature is controlled, the humidity, the lighting. Sometimes plants have to be under lights for 18 hours a day. The next room, there were 12 hours a day. It's really complicated, and it really is a science. So if you are deciding you're going to home grow and home cultivate, it does require certain equipment, high-powered lamps, temperature controls, ventilation. So work with your local fire department if you're going to do that, so you can reduce your risk of any type of electrical fire. You consult a licensed electrician. You just want to make sure that you're abiding by all the relevant fire codes. And then also, plants can't be visible. So if you decide to grow, they can't be visible from the street or a public place without the use of binoculars, aircraft, or drones or other optical aids. So you don't want your neighbors seeing your weed. Okay. So this is fairly new, I'd say in the last year. Massachusetts, you can buy seeds and clones. So if you do want to decide, okay, I think I have a green thumb, I think I can do this, then you are able to go to a dispensary and buy seeds or an immature plant, which is known as a clone. Okay, so everybody knows about the retail, right? And I hear, oh, there's one in every corner. Well, there's not one in every corner, but there are quite a few from where we were 7 years ago. But there's other types of license types, right? What makes this a $7 billion industry? What does the supply chain look like? So cultivation in Massachusetts, you can have anywhere from tier 1 to tier 11, which is up to 100,000 square feet of canopy, we call it, where you grow. And most of the cultivators, because of the climate in Massachusetts, are indoor cultivators, but God love them in Western Mass, there are quite a few outdoor cultivators who, they have a certain peak harvest season, and it's really challenging to be a farmer in New England. And so my hat's off to them, it's really tricky. We have craft cooperatives kind of modeled after the cranberries, where farmers will get together, they have to be recognized as a cooperative, there's certain rules and laws they have to follow. A micro business is a small grow or product manufacturer. We did this so folks could get into the industry. Does anybody know how much on average it costs to open those dispensaries you see? Anyone want to guess? Anybody?
Million.
At least $1 million in about a year. Now don't forget, it's really no banking, right? So how do you raise that capital? It's really challenging. So you have to find investors. It's really complicated, highly regulated. In our application process, we do require a lot of things, right? We require background checks and fingerprinting and financials and your business plan and your architectural plans, and so there's a lot, and there's a lot that goes into it. Product manufacturers, the ones that make the candy bars, that make the seltzers, that make the gummies, that's a license type. The retailers, you know what those are. Research, we do have a research license type. We have a couple of folks in the queue, so I'm really optimistic we'll start to see that. We have folks that transport it, and we have folks that transport business to business, like they're called third-party transporters. So if Kim Roy's Cannabis wants to sell to Michelle Drum's cannabis, then a business to business will drive it from one to the other. And then we have transporters that do home delivery. And that's B2C, business to consumer. And not every town allows for home delivery for adult use, but every town mandated in law has to allow delivery for medical. So let me repeat that. By law, every town in the city of Massachusetts has to allow medical delivery to your home. But not every town has to allow adult use. So it just depends on your town. We do have a tracker on our website if you want to know. Independent testing labs, we have about 16 of those in the state. So that means every product that is cultivated before it goes onto the shelves for you to buy has been rigorously tested for pesticides, pathogens, heavy metals, mycotoxins. We want to make sure your products are safe. Mold and yeast, we make sure that it doesn't have mold and yeast. And then delivery, I talked about that. And does anybody know what social consumption sites are? Close. You're right, close. So cannabis cafes is another term folks refer to it as. It's in our regulations. It was part of, people passed it in the law, so it got voted on. We had a glitch in the regulations and in the law, actually, where the Secretary of State said, not so fast. There's no mechanism for communities to opt in. So the commission and the legislature had to rework some things. And so now we have two commissioners, Commissioner Clargo and Acting Chair Stebbins, who are the architects of drafting the regulations around social consumption. They're doing that now. And then the commission, although there's 5 commissioners, 4 right now, we're bound by something called open meeting law. And what does that mean? That means only 2 commissioners can talk about a policy or a topic. And if the 3 of us go to lunch, we're breaking the law. We can't. So only 2 of us can talk about so it makes it a little tricky. So I know as much as you do on what's in those social consumption regs. I don't know. I'm not in that group. And everything we do, we have to do at our public meeting. We have 1 to 2 public meetings a month. And we have to air our laundry in public meeting because we are a government agency bound by open meeting law, which is very good in a way. It brings transparency. Okay, so as I open with adult use has done $6.3 billion in sales, and then combine it with medical, we're over $7 billion, but sales in 2024 through June, we're already at almost $800 million in sales. Pretty incredible. Tax revenue. So state and and local taxes have generated $1.1 billion in revenue for the Commonwealth of Massachusetts. Think about this. It outpaces alcohol and excise tax. Now think of all the places you can purchase alcohol. And we have 300 plus retailers, and it's outpacing alcohol in sales tax. So we're hearing anecdotally, a lot of young people tend to be gravitating more to cannabis. They don't like the feeling that alcohol the next day. Some people say, hangover, whatever. So we're hearing anecdotally that maybe, they're gravitating more. Older Americans, very curious for comorbidities and ailments, are learning more about cannabis as well. So I think as we get more research and more education, I think that'll help grow the market as well. So where does the money go? So the money doesn't go back to the Cannabis Control Commission. It goes to what's called the Marijuana Regulation Fund. So the taxes that you pay on cannabis help the community, go back and reinvest in the communities. It goes to public health and substance use addiction programs, community empowerment grants, reentry grants. It goes to community colleges. How great is that? Some of the tax money, and agriculture oversight of hemp. So cannabis, fun facts, as I said, cannabis outpaces cranberries now, and we love cranberries, so no disrespect to our friends who grow cranberries in Massachusetts. Fun fact also, that cannabis sales now outpace chocolate nationwide. Who knew that? That's unbelievable. And there's more cannabis dispensaries, I read the other day, than McDonald's now, so that kind of tells you a lot. So I asked for this map because it really tells you where the industry is headed. So back in 2018, Massachusetts was in green, the only state with legalized adult use cannabis in New England. First state east of the Mississippi. Now fast forward, in every state except New Hampshire, and I know there's efforts there, do have adult use cannabis now. So that's quite remarkable in a short span. So for retailers, I lied, we're at 531 that have commenced operations in Massachusetts, and every county has them, and Worcester County has the bulk of them. So Worcester County has 85 adult use retailers that you can visit. Okay, our social equity program. So that's Stephen is a important part of that. And when I opened, I talked about communities that have been disproportionately impacted by previous cannabis prohibition. So a lot of folks, perhaps got arrested or incarcerated due to activities in the cannabis space when it was illegal. So part of the commission, when the voters voted on it, they wanted an equity mandate. So we identified through hiring folks that did a study, and UMass Donahue was one of them, that looked at communities, looked at arrest rates, and identified communities that the commission has to positively impact. And licensees have to positively impact. And what does that mean? When they become a licensee, they have to demonstrate that they're going to be good business partners in the community, and they're going to positively impact to help folks, whether it's expungement clinics, whether it's hiring people with prior incarceration record, or family member that had incarceration record. Hiring people from diverse backgrounds, that's important as well. We have cohorts, we teach people, we provide technical assistance, so if you fit this category, we have certain criteria. If you match that, you apply to our program, and if you're accepted, we try to provide you the tools to succeed. We business plan writing and how to succeed in the cannabis industry. And once you're in the program, you're in it for life. And we're going to have a new cohort hopefully start up in the next few months. And then more folks will learn about how to succeed in the cannabis industry. Recent updates. So we have exclusive license type for social equity. So delivery, social consumption. And then let's see, we updated our regulations last October. We were mandated, the legislature let the regulations breathe for a while, and they said we got to go back in, and they made some changes around some parameters within the industry. And so we had to, 1 year the commission had to promulgate regulations to match the legislation. So we did that. And we're also looking to update our microbusiness delivery and make telehealth permanent, as I said. Social consumption, we talked about that. Some states are already a little bit ahead of us. Alaska, California, Colorado, Illinois, Michigan, New Jersey, New Mexico, New York, Nevada. Not all of them have a site open, but all of them are making strides towards that. And before I go to rescheduling on cannabis, part of what the tax money goes to is called the Social Equity Trust Fund. And it was just in the Boston Globe yesterday, and the governor just announced yesterday, that $25 million are going to be distributed to folks in the either in the cannabis space or trying to get in the cannabis space that apply to the program for no interest or low interest grants and loans, because again, there is no banking. There's been predatory lending, unfortunately, and some people have fallen victim to that. So the percentage of the taxes will go now to help folks in this space so that they are able to succeed and maybe create generational wealth for their family. Rescheduling cannabis is, the federal government is looking at that right now. The commission provided some written testimony on what we feel would be vital to the industry. We don't know where this is going to go. If it's a schedule, if it goes from no medical value to having medical value as a Schedule 3, I don't know. Will you have to get a prescription? Who knows? We don't know. But my hope is that there will be more education and there will be more research to help you make informed decisions, because you really want to make an informed decision. I've had so many people anecdotally come up to me. I went to an event last weekend in Mendon, and it was pouring, but we were there, myself and Commissioner Stebbins, and folks came up. One woman was completely incapacitated with Lyme disease. And she said that this helped her, was like a miracle. Now, I'm not giving medical advice, so please don't construe it as such, but these are some of the stories I hear as I travel around the state. Whether it's folks that are veterans that have had PTSD or depression. So it's encouraging to hear that there's promise with this plant. We just need to know a little bit more. So the commission is really being proactive and getting in the community, meeting with stakeholders, meeting with folks. We went to Martha's Vineyard, and then we just went to Great Barrington, beautiful place, way out in the Berkshires, and we talked to outdoor cultivators. We're going to have a meeting next month in Worcester, and then we're going to have one in November, and we're going to talk to our labs, because this is still an emerging and evolving industry. And even though we have thoughtful regulations, things change, and we're trying to keep up and be responsive. And the best way to do that is to talk to the boots on the ground and the folks who are growing the product, testing the product, selling the product, and we do that. And we try to be really responsive that way. Okay. So having said that, that's my presentation, and I'd be more than happy to entertain any questions.
Mike?
Well, I understand that there's only certain physicians that can prescribe this cannabis, or how does that whole work?
You're correct. So
Do they have to have a license to do it?
yeah, so they have, Kathy, if you want to come up and talk to, so they have to be recognized by the commission. They have to do some requirements to be a certified medical provider that we recognize. And there's 300 plus that are physicians, over 194 nurse practitioners, and 1 physician assistant. So chances are your primary care provider that you currently have probably is not, but it's worth asking. And if not, then maybe they can recommend someone to you.
What if his name is like Dr. Feelgood? He could probably.
I know him.
Yes. But they're out there. They are out there. And the nice thing is, say you live in Charlton and the closest one is Worcester, you don't have to drive to Worcester anymore. You can do a telehealth if you have access to a computer.
You're saying there's some in Charlton that can do it, or?
No, I'm not aware of that. So what I'm saying is you have to look on the internet or talk to your healthcare provider, and they can recommend one.
Okay.
I recommend talking to your healthcare provider for them to
Yeah,
recommend.
start with your healthcare provider.
I've been talking with my healthcare provider.
Okay.
He's not going to do anything, but he said, get gummy bears. I haven't done it yet. I'm a little afraid of doing it.
Mm-hmm.
But what medical things are that, how do I want to say this?
Qualifying.
Thank you.
So
That's
Kathy,
the word I want.
So Kathy went over them. There's a number of them, right? So weakness, chronic pain, the cancer, glaucoma. There was a list of them. But there's one that's kind of a catch-all. So like my mother has an autoimmune disease, right? She doesn't necessarily have one of those diseases that were listed, but she has chronic weakness. Mm-hmm. So there's one that's kind of a catch-all that can cover a lot of territory with a provider to get you certified.
And the suggestion to talk to your healthcare provider, they can actually coordinate and help that and give you information that you can talk to the medical marijuana healthcare provider.
Well, he didn't give me that much information.
Yeah.
He said I could go into a dispensary and they could help me from there. Is that?
Yes, so
Call you?
call Kathy. Yeah, so yes,
I will call you.
Yes, and you can go into anyone here can go into a dispensary and have a conversation with their bud tender and you know, and if you had minimal or no experience with cannabis, it's really important you share that because again, we want to make sure that you it's a positive experience and you go slow, start low, go slow because you want to see how your body would adjust if you decide that that is something that you would like to try as a therapy. Everyone has what's called an endocannabinoid system. And the cannabis plant has cannabinoids. So from your digestive to your cognitive to throughout your body that interacts with the cannabinoids in cannabis. So medical schools only started teaching about the endocannabinoid system 20 years ago. So hopefully the newer generation of doctors coming through will have more information on the importance of the endocannabinoid system and how cannabinoids can positively interact to help with whether it's, I mean, not to share too much information, I suffer from digestive issues, right? So if it can help me alleviate some of that because your digestive tract, you know, has the endocannabinoid system. So cannabis has cannabinoids. They have terpenes, which give it a certain smell. I mean, it's unbelievable. You can see some smell like lemon, some of them smell like blueberry. That's called the terpenes. Like that's the smell, and the cannabinoids give you the effect, the desired effect that you are looking to, whether it's pain or whatever malady you may have. That's what you take.
Well, go ahead.
Go ahead. What exactly is THC?
THC, or otherwise known as Delta-9, is the psychoactive component in cannabis. That's the component that gets you high, if you will. It's a Delta-9. Now, some of the products that are out in the market, and I'm not, again, no medical advice, I'm not giving that, but some of the products have like a ratio. And you'll see other cannabinoids in there, like, who's heard of CBN or CBD, right? And so some of them help maybe sleep. So some of the gummies you'll see maybe 3, 2, 1. So 3%, 3 CBN to 2 THC to 1 CBD. Like they have different combinations. And some of it minimizes the high. So the CBD and the THC, the CBD will help minimize.
So the lower the number, the better.
The lower the number, the percentage, right? Because THC is not your grandparents' cannabis anymore. So some of the THC can be quite high than it was years ago. But also now you have different cannabinoids that are helping people, and they combine them with the THC. So really, honestly, the best route is to have a talk with a provider.
Well, I think you're right. I think there should be a lot more, they should be looking into this scientifically a lot more.
I agree.
Because I don't think they really know all the ins and outs of this product.
Mm-hmm.
In Arizona, even dead people can get marijuana. I mean,
Okay.
they don't really have a lot of restrictions.
A lot of restrictions there,
Now,
yeah.
if you can breathe, you can get it.
Right. Okay.
Yeah,
In Massachusetts, we do have restrictions, and we adhere to them. But that's just to keep everyone safe.
And these people the people that have these stores that sell cannabis, they have to be licensed by the state, obviously, correct?
They do. They have to a very rigorous application process. As I had mentioned before, everything from background checks to fingerprinting to financials to a business plan, disclosures, attestations. It's rigorous, and it takes.
Well, I know you mentioned it, but how much of that goes back to the state now? Is it just like a tax that they pay, or how does that work?
So when you go in and you buy cannabis, there's 3 taxes on it. There's a sales tax, right? Massachusetts sales tax, and the Massachusetts excise tax, and then a local option tax. And you add them up, and it's 20% on adult use. And the medical use side, 0% tax because it's medicine. Anybody else? Yep.
Does health insurance cover any of the medical use?
No, and if that ever comes to be, that will be a game changer. It will be a disruptor. Imagine if your health insurance or Medicare covered it, I think that would be an enormous disruptor, a game changer in a positive way to the industry. And I think rescheduling can help move the ball in that direction, and we'll see where it goes. But think about it years ago, right? Acupuncture wasn't covered by health insurance years ago, right? So I'm saying I don't have a crystal ball or a magic wand, but I'm holding out hope optimistically that someday we're going to see that.
I know you kind of glossed over the laws regarding using cannabis and driving. I mean, what exactly, how does that all work?
Can't do it. Now, have all of us been by a car that smells?
Oh, yeah.
Does it make me so upset? It does. Because we want everybody to be safe. So it's illegal to have an open container of cannabis in the car. It's illegal to use cannabis while driving. Does that mean people do it? Yes, they do. Do people drive drunk? Yes, they do, unfortunately. And so we just want to keep everybody safe.
Well, I know with alcohol, I mean, there's a certain level. I mean, you can have 1 drink, 2 drinks,
right,
or whatever, drive, but with cannabis.
Yeah, so that's a great point. And that was part of the reason why I wanted to do the driver's ed. Because in alcohol, we all know 0.08, you're drunk, and there's a breathalyzer. But cannabis, the science isn't settled. So alcohol is water soluble. So the breathalyzer is very accurate if it's calibrated right. But if cannabis is fat soluble, and what does that mean? That means you could have ingested on a Saturday on your couch watching a movie, and then you get in your car on Monday, and if you were to be tested for it, you test positive for cannabis because it can stay 30 days or longer, depending if you're a chronic user. So the science isn't settled. There's no science. There's no breathalyzer. So what do we do in lieu of that? We educate our young people, and we educate people that you can't use it while you're driving. And if you feel different, you're going to drive different. And know how long a product takes before it will kick in, like a gummy. You don't want to take a gummy, wait 20 minutes, say, didn't work, and get behind the wheel of a car. So this is what drives me, no pun intended, to come out and talk to you, because I want you all to make informed decisions when you do consume, and hopefully the science someday will catch up, but right now it's just not there. So that's a great point. Thank you for bringing it up. Anybody else?
Well, there you go. Or operate heavy equipment.
Yes, that's another thing in the workplace. No, you're right. That is true.
But on the laws of the pot, I'm going to go kind of ideas. Can you smoke it in public?
No.
That's
you're
what
not
I
supposed
thought.
to. Well, a private, so not in public, but a private place.
Out in the parking lot.
No, not supposed to.
It's public.
Does it happen?
Yes.
Yes.
Because
Yes.
we do cruise night and we can smell it
Yeah, I
all the time.
Yeah, all the time.
I know.
Yeah.
Oh yeah,
Every
especially
Thursday
when
I
they
saw it.
drive by. It's like,
I know.
Yikes.
And I'll just say to the employees too,
Not-
they come
not
out the
our
back,
people.
they might be doing
Well,
it.
not our people.
not our
Yeah.
people.
Not our people, no.
Yes,
Oh.
yes. And to the heavy equipment point that you made, I know companies, and I've met with some of them, are looking at different ways to test for peak impairment before you're able to operate heavy equipment. So they are looking into that. There's different, people are looking at all different things. Sweat as a test, eye movement. There is a breathalyzer that they are trying to develop. I think it's in trials. So people are trying to, whoever comes up with that is going to, if they can come up with that science, it'll be pretty amazing.
Well, UPS, you have to do a urine test every so often.
Yeah. Yeah.
And
And a lot of truck drivers, my husband, he has a business and they ship oil, and
Right.
so he has to get tested. My son does. He works at the family business, so they do have to get tested regularly. And you know what? That's to
Well,
keep
there's
us
a lot-
safe,
a
right?
lot- that's a lot of
We want
liability.
everybody to be safe at the end of the day. That's the most important thing. So, well, I think that's it. And thank you so much, Michelle, again for inviting us here, and thank you to our team.
I would like to thank Charlton Cable for being here today, all of Commissioner Roy's staff at Mass Cannabis Control Commission, Kathy Oliver Jones for her presentation, as well as Miss Commissioner Kimberly Roy. I also would like to just also thank, we have our largest promoter of our newsletter, a supporter of our newsletter, I should say, is Munchies.
All right.
which is a business in Charlton. So I just want to thank them for their support of our newsletter as well. So thank you everybody for coming. I hope we see you down at the Charlton Senior Center. And thank you again, Commissioner Roy.
Thank you, Michelle.